Thank you so much for joining me here on stage for this crucial discussion, Investing in Humanity, Unlocking Private Capital for Global Progress. In this panel, we'll be discussing the challenges as well as the optimism and solutions in the sector and how we can learn from inspirational examples of successful, impactful partnerships and what finance models, technologies, and innovations are needed to accelerate change. So, Bill, if you don't mind, I'm going to start with you. So, of course, the world has seen incredible progress in tackling huge problems like child mortality, which has been cut in half in the last 25 years. But if we know what works, what is holding us back from saving even more lives, especially from preventable diseases?
Well, the outcomes in global health are a combination of the generosity of resources going to help, particularly the poorest countries, to run high-quality primary healthcare systems. It's a factor of how much innovation we have, creating new low-cost tools, and it's a factor of how well we execute, the quality of those delivery systems, understanding what's working and what's not, and learning from the heroes in the field, learning from the very best practices. And as you said, the 25 years up till now, we had everything working in our favor. More generosity, Gavi buying vaccines for all the world's children, Global Fund working on areas like malaria, HIV, and TB. And we came a long ways. We have a little bit of headwinds now in that generosity. This is the first year it'll go down. And, there's a direct connection between how much we spend buying those tools, helping those primary healthcare systems, and the lives we save. So we have a bit of a reversal, back up from 4.6 million to 4.8 million, almost entirely in Africa. Asia continues to make good progress. And the name of the game here is that if a country is healthy, then it can educate its kids and have economic growth and become self-sufficient. So many recipients like India and Indonesia, Vietnam, took Gavi money and other primary healthcare work and now are completely self-sufficient. And although we have a long ways to go to get every country to that point, our aspiration over the next 20 years is that we get every country to have healthy kids who thrive, and that they're completely self-sufficient.
We're talking about a long way to go. Your Excellency, Dr. Barakat, if I can bring you in here, while we're seeing many traditional donors retreat from global development, others, like the UAE, are stepping up. The UAE's leadership in global development, particularly in priority areas like global health and disease eradication, is rooted in a collaborative approach that brings new partners to the table. What makes this model so distinctive, do you think? What unique strengths does the UAE bring to these partnerships?
Thank you. So for the United Arab Emirates, global health is part of its foreign policy and economic prosperity agenda. And we do this through collaborative approaches, but specifically long-term and innovative collaborations, and not through short-term projects. So I think this is a key factor. And we also, everything we do is underpinned by the vision of our leadership. His Highness the President believes that no child should die or be debilitated by a preventable disease. And if you look at what the country has been doing for many years, so for instance, in terms of official development assistance, we have, most of the last 10 years, we've been either the top or near the top of the ODA as a percentage of the gross national income. Polio is an example. We don't give we don't give loans to countries, especially the ones that are heavily in debt. You know, the UAE mostly gives grants, which I think is really helpful to some of the poorest countries. Polio, His Highness the President has personally given $380 million in the fight against polio. Guinea worm, we have over a 4-decade history with the Carter Center, collaborating with them to try and eliminate guinea worm. And that started with the late founding father of this country, His Highness Sheikh Zayed, may God rest his soul. We have projects around the world. We have built over 100 hospitals in some of the poorest countries. But I think the question is, can one entity do and cover all these complex challenges, be they polio or survival of mothers and children or neglected tropical diseases or malaria? And the answer is no. And I think the two distinguishing factors of the model of the UAE, there are, firstly, it's collaborative encouragement. You know, we have an audience today where we have decision makers from governments, funders from governments, we have philanthropists, and we have the private sector. And when you have this collaborative approach, you get a multiplier effect. And in particular, you get better ideas, you get better momentum, you get better networking and better outcomes. And especially with the private sector, I think, you know, they bring in an enhancement to the speed of delivery, and they bring in scalability, and they bring in innovations. You know, they can pull in innovations much more quickly. So I think that's one element, which is the collaborative approach. The other element is the unique convening power. We know through previous fora, such as this one, for instance, the Reaching the Last Mile Forum in 2019, the audience was able to commit to billions of dollars against polio, $190 million of which came from His Highness the President. And in COP28, similarly, the forum was able to get commitments for $777 million for neglected tropical diseases. So I think these are the two elements that really kind of make our approach from the United Arab Emirates different. Thank you.
And sounding that collaboration is key, Dr. Daba, Ethiopia has made remarkable progress in expanding access to essential healthcare over the past decade, from maternal and child health to immunization. From your perspective, how do you think sustained investment in health has helped drive that progress? And what role do innovative country-led partnerships played, and what lessons do you think have you learned about building resilient and effective partnerships?
Thank you. Over the past 25 years, if you look at Ethiopia and a topic that we talk about, polio, it was during these 25 years that we eradicated the polio. We have done a lot over the past 25 years. Maternal mortality reduced, child mortality reduced, even more than by half, and infant mortality also reduced within these 25 years. Collaboration has helped us bringing women closer to the community closer to the facility, and providers closer to the community. It was possible due to collaboration, efficiency, and a trust in each other. Government, philanthropists, non-governmental organizations, international organizations, global and regional collaborations coming together. Within the past 25 years, Ethiopia was even able to reduce, if you look at all the burdens that we were looking from eradicatable type of diseases to increasing life expectancy, we pushed life expectancy by more than 20 years within the past 25 years. A lot has been achieved over the past 25 years, but there is a lot to be done now. The globe is changing, the environment is not the same. But if we come together, just like we did before, but in an urgent manner now than before, we can really accelerate, and we can achieve better than what we have done over the years. And I believe if we align with government priorities, government set point, which is aligned with community, because it is all about what the community will ask. And then we bring philanthropists to help in catalyzing some funding so that we can increase the fiscal space, so that finance can also flow to the country. There is a lot that we can achieve, and there are examples even from our country, from compacts we have done, from family planning compact, from MDG pool fund, SDG pool fund, which continued. There is a lot that all countries can learn from each other, and solution is there. We know what innovation can bring, and it's possible.
Bill, how do you feel when you hear these practical examples?
Well, at the turn of the century, I was stunned to learn how little money went into saving children's lives. We had vaccines like a diarrheal vaccine that was being given in the rich countries where the kids had very little risk of dying, but not being given to the kids who needed it most. And so the fact that over this 25 years, the ability to really measure how many kids are dying, what are they dying of, exactly what new tools do we need, let's invest in those, let's bring the price down. It's been phenomenal. Ethiopia is a great example where they prioritize the primary healthcare system. They're coming up with an overall health plan. They coordinate the donors to give to that plan. And so even though the world has seen this 50% reduction, Ethiopia has seen even greater than 50% reduction. So it's a real joy, the partnerships that have come together. We do need to remind people about this because it's far away. We have a child born in Nigeria is 30 times more likely to die than a child born here or in the United States. And it's been interesting talking with our phenomenal partners here in the UAE about, their connection to this cause. They think back just a few generations and they think, okay, the situations we lived in weren't that far away, certainly 3 generations ago, than what many countries are still dealing in. And then, so it's amazing how you feel that connection. Of course, I always encourage people to go visit and see these things because everybody, deserves to see that, a single child's death is a tragedy. And here we're talking about, saving millions of lives, preventing millions of kids from being paralyzed from diseases like polio.
It's interesting though, isn't it? Because there are so many global causes worth investing in. Why do all of you feel investing in advancing global health and disease eradication is the priority? And why now? And where do you see the greatest opportunities for this impact?
So for us, a healthy population is a prosperous population. I think that goes without saying. And global health is not charity. It's an investment in human capital, in economic stability, and in security. Yeah. So it's really important. Polio is a great example. I know we're running out of time, but polio is a wonderful example for what can be done. Since 1988, the numbers have really plummeted to below 99% of what they used to be. However, we cannot stop. And yes, the latest figures from last week, we have 39 figures worldwide, only in 2 countries, Pakistan and Afghanistan. And if we stop now, not only will we not finish this, but the numbers will mushroom and spread, not just in 2 countries, but in most countries in the world, and we'll go back to having hundreds of thousands of unnecessarily paralyzed or even worse, for paralysis for our children.
Well, what Her Excellency has said, Bill, if I can ask you now, polio, of course, was once a global threat. Today, we're in the last stretch of eradicating the second disease in history, saving lives. How close are we, do you think, to completely eradicating it? And what would it mean for future generations?
We can eradicate polio, but it takes everyone to come together. If you look at the current challenge that we are facing at a country level, it's a cross-border related issue. We have to coordinate. If we really want to, it's usually the last mile, which is very difficult. So we are now at that last mile where we need to close the loop, and it takes everyone, philanthropists, private sector, government, not only in one country, but cross-regional and cross-country collaboration. There is a lot that can be done, but it needs that last investment and focusing in, engaging the community, engaging leaders, engaging family, and making it an agenda, not just at a stage like this, but a community talking about, can we really do this? And the community owning it. That way we can really run the last mile, and innovation can help us around it.
And Bill, are you optimistic? Complete eradication?
No, I'm very committed. We're having to innovate. We're having to strengthen partnerships. We have the two countries, Afghanistan and Pakistan, where we still haven't gotten to zero, but we have great work going on there. And then we have to clean up the reinfection that took place in Africa. But we know how to do this. We have incredible tools, and days like today should re-energize everyone to push all the way to the finish line, which will be an incredible milestone for humanity.
Well, thank you so much to all of you for joining me today. Please join me in thanking our distinguished panelists, Her Excellency Dr. Maha Barakat, Assistant Minister for Health and Life Sciences, UAE Ministry of Foreign Affairs. Thank you. Her Excellency Dr. Megdas Daba, Minister of Health, Ethiopia. And of course, last but not least, Mr. Bill Gates, Chair of the Gates Foundation. Thank you so much to all of you. Thank you. Thank you so much.